My name is Kate Armstrong. I'm working with two organisations. One is a grassroots NGO based in Australia called CLAN, and the other is NCD Child. And it's a real privilege to be working here today with so many people who are so passionate about NCDs. I'd like to share with you my own journey, how I came to be here. In particular, my passion for a life course approach to NCDs, which is this concept that what happens to us at the earliest stages of our life, even before we're born, when we're newborn babies, children, adolescents, has a huge bearing on our ultimate health as adults and our capacity to fulfil our full potential as human beings. As I'm talking, if you can think about children that you might know who are living with a chronic health condition or an NCD, whether it's here in your country where you're living, or whether it's a family member or just someone you've heard of, I think most people would know about children with a chronic health condition, an NCD. My story starts with a dream when I was 19 years of age of a love. I just experienced it in a dream, and it was overwhelming, it was overpowering, it was on a level I'd never experienced before, and I just couldn't even understand what this love was. Until 10 years later, with the birth of our first child, as a mother, I understood what that love is because I was feeling it all over again. 3 weeks later, though, the story wasn't good. Our son was dying, and I remember asking my husband to take a photo of him because I just felt we were losing him. Echoing the stories today, we were so lucky, though, living in Australia, and we were able to access amazing healthcare, health professionals. They diagnosed a chronic health condition, a type of NCD, started medicine, taught us how to care for him, and he started to get better. And he just went from strength to strength. 5 years later, he was doing really well. He was at school, he was excelling at sports and academically, and it was just fantastic. But then I read stories on the internet of children with the exact same chronic health condition in Vietnam, and the picture wasn't so great. They were dying, they were becoming disabled, socially isolated, discriminated against, and the enormity of the global inequity totally blew me away. What really distressed me is I knew how narrowly I had escaped grief, terror, loss on a scale that was unimaginable, and yet families in Vietnam and a few other developing countries weren't escaping that, they were living it. Whilst these families were very powerless as individuals, I soon learned through trips to Vietnam that when you brought them together as a community of families all living with the same chronic health condition, they became quite powerful. And they could then be empowered to work with a broad range of stakeholders, whether it was different NGOs, philanthropists, industries, to help their children achieve the highest quality of life possible. And through the work with CLAN over the last 9 years, I've had the privilege of speaking with and learning from thousands of families of children with a whole range of chronic health conditions. And they consistently tell us that they want 5 things: affordable access to medicine and equipment, education, research and advocacy, optimal medical management, encouragement of their community, and they don't want to be impoverished. They want to be financially independent. And working with so many others, we've learned over the years, we've made great changes. We've seen mortality drop, we've seen hospital admissions halve, and we've seen community numbers swell. But it always feels like there's still so much inequity in the world for children with chronic health conditions, NCDs. In 2010, CLAN was formally associated with the United Nations Department of Public Information for NGOs, and we attended an event that they held in Melbourne. Towards global health for all, achieve the MDGs. We held a little panel, and our message was so simple. It was, children get chronic health conditions too. Because at that stage we weren't using the word NCDs back in 2010. It was all about chronic disease, lifestyle disease, and the language was systematically excluding children and adolescents. Someone said, do you know about the United Nations high-level meeting on NCDs in September 2011? I thought, wow, this is fantastic. I went and read it all up on the internet, and yet it wasn't. I read the draft declaration, and children were not mentioned once. Here we were, the UN was about to have its second only ever health meeting on the topic I was passionate about, and they weren't going to be speaking about children. Again, this is where working together is so important. I approached the NCD Alliance, the civil society voice for NCDs, ahead of the UN high-level meeting. And within a very short period of time, we brought together an amazing cohort of incredibly passionate people. We had so much work to do. It was the end of 2010. The high-level meeting was in September 2011. We wrote policy recommendations. We wrote discussion papers, set up a website, Twitter, Facebook. By the time September 2011 came along, the final political declaration did include children. I think there was about 8 mentions. I was, going over it like with a fine-tooth comb. And yet, there's still so much to be done. We've had some wins. We had our first conference in Oakland last year in March 2012. And from that, we've been able to formally launch NCD Child as an independent global coalition committed to putting children and adolescents on the international NCD health and development discourse. I'd like to really specifically call out and thank one of our founding members, Harvard Global Equity Initiative. And I'd also like to thank NCD Free for the opportunity to partner like this today, because I think this is where it's all at, working together, collaborating. There are signs that we are making progress. At the World Health Assembly in May this year, the member states officially recognised children can die from treatable non-communicable diseases such as rheumatic heart disease, type 1 diabetes, asthma and leukemia if health promotion, disease prevention and comprehensive care are not provided. That's fantastic. That's a real major breakthrough. But there's still so much more to be done, because if we're going to tackle NCDs, we have to really start at the start of the life course, because not only are children affected by NCDs, if we want to deal with smoking, nutrition, activity, inactivity, alcohol, we have to start as early as we can, because if we're just focusing on adults, we've missed the boat. If I can leave you all with one thought, I'd really like to have you all leave believing that you can be powerful advocates for children and adolescents within the NCD discourse. The United Nations Convention on the Rights of the Child tells us we have to make specific efforts, that we all have a responsibility to play. Everyone has unique needs. You can bring them to the table. Because if we're going to make a difference for NCDs, we have to allow ourselves to really care about children, to really feel a love for the situation that they're in. We have to really maintain outrage with the global inequity that exists. And we have to genuinely collaborate and work together. And I really believe if we do this, we can make a difference for NCDs. And I really believe that it's a matter of justice now, not charity, that we do this. Thank you for the opportunity to talk with you all.